What we're going to be talking about today in our video is scaling and root planing versus gross debridement, how you make that determination. Once you make that determination, how you explain it to your patient. So we're going to do a couple different scenarios. I've already done all of my assessments. I've done my probing. I've done my evaluation. I've taken a look at the calculus. I've felt it with the probe as I'm going around. The radiographs are already taken. So now I'm going to explain to my patient where we go from here with our treatment. So the first thing we're going to discuss is gross debridement. I do my assessment, sit the patient up, so I can talk to the patient eye to eye and discuss what has to be done, and they can ask me any questions. I also have the radiographs up because then that way I can show them things. So Caitlin, I evaluated your mouth as we did the measuring, as we talked about. 3 and below is within the normal range. 3 is actually ideal. You haven't been here for about 4 years, so I was a little bit concerned when you came in because that's, like 8 appointments that you've missed, and you really do have a lot of buildup on your teeth. You know that already because you had mentioned it to me. The good news is, though, when we take a look at your x-rays, your bone level looks really healthy. Your tissue is a little bit irritated in some spots, but not too bad. So what we're going to do is we're going to today start with what we call it a gross debridement. I'm going to clean your teeth. I'm going to use mostly the ultrasonic, get as much of that buildup off. We're going to talk about how I want you to take care of your teeth until you come back. You'll come back in a week or two. We'll finish up with a regular cleaning at that point, get all the calculus off, get everything nice and smooth, make sure you're doing a good job and that your gums are responding. If everything goes well, you're young, you're healthy, and you have good bones, so chances are it should go really well. And we'll have you back in about 3 to 4 months after that, and if things, you're doing your part at home and you come in on a regular basis, then we can probably get you back to a regular 6-month recall, which is what you were doing before.
Okay.
So do you have any questions about that? Okay. Now we're going to talk about what happens when a patient comes in thinking they're going to have their teeth cleaned when actually what they need is scaling and root planing. I've already done my radiographs. I've already done all my assessments. When the patient came in, they were told we'll have to see where you are and then we'll decide what your treatment is going to be. So now I've sat the patient up, we're going to have that conversation. Caitlin, as I told you when you first came in, it's been a while since you've been here. We'd have to, take a look at everything, see how healthy your gums are, and then decide what your treatment is going to be. When I took your x-rays, one of the first things that I noticed is that you have a lot of buildup in between your teeth. Can you see those little white spurs that are in between? That's called calculus. There's a lot of it down underneath your gum line, and because it's been so long since you've had your teeth cleaned, the bone has started to disappear, where there's a lot of buildup or calculus in between your teeth. Your gums are really irritated and red. There was a lot of bleeding when I was doing my evaluation. So what we're going to do is do a little bit more intensive therapy. We're going to do what's called scaling and root planing. In the back here you have some pockets that are 7 and 8 millimeters, and we had talked about how 3 is the ideal. So you've got some quite deep pockets back there. Those areas are areas that really concern me. So what we're going to do today is we're just going to go over some home care. I'm going to tell you, what I want you doing in the meantime, and we'll get you rescheduled for another day. We'll start the scaling and root planing. Typically what we do is do a side at a time. I usually start on the right side just because that's what I prefer. If you'd rather have the left, just let me know. And you'll be numb on the upper and the lower. It'll take about 1.5 hours to 2 hours. And I'll just be doing a lot of work in there, taking off all the buildup that's on your teeth. Then I'm going to be doing some hand instruments just to make sure that the roots are really smooth. And once all that's been removed, the idea is that that tissue will shrink up and it'll reattach, so those pockets will close up. Statistically, usually get about a 2 millimeter change with the pockets. So where you have 6 millimeter pockets, we could bring those down to 4, and it's easy for you at home to be cleaning in there with your brush and your floss. Then after that, you'll have to come in more regularly, because once you have gum disease, it's a chronic disease. We manage it, but it doesn't completely go away. It's not like if you have appendicitis, we go in, take out the appendix, you're better. This is more like diabetes or something like that, where you have to kind of really watch it your whole life, and you have to be really good about taking care of your teeth and coming in for your appointments. So after the scaling and root planing, you'll come back in about 4 to 6 weeks. We'll reevaluate, we'll remeasure, we'll see where you are. If things look really good, then from there we go to a 3 to 4 month recall, depending on how your mouth looks. Okay.
Mhm.
So let's go over the brushing, and then we'll take you up front and get you scheduled to start the scaling and root planing.
Okay.
Any questions about anything?
No.
Okay.